Hi, this is Wayne and I'm an audiometrician from Hearing Partners. Today we're going to talk about brain hearing. The latest scientific breakthrough shows that the brain can handle access to more information from the full sound scene. Our brains are capable of making sense of sounds in our environment, warning signals and speech. This sound processing in our brains is handled by constant interaction between two subsystems of the hearing region, Orient and Focus. The Orient subsystem always comes first. When we hear, it scans all surrounding sounds, no matter their natural or direction, to create a full perspective of the sound scene. The Focus subsystem helps people select which sounds to listen to. Once you have an overview of the sound objects around us, we use the Focus subsystem to identify the sound we want to focus and listen to while filtering out irrelevant sounds. When the two subsystems work well together, the rest of the brain can work optimally, which makes it easier to recognize, store, and recall sounds. This leads to overall lower listening effort, so listening and concentrating isn't so tiring. Downgrading input to the brain and failing to treat the hearing loss is the correct way can have a variety of consequences. Some of these include increased listening effort, mental load, and reorganized brain function. A hearing problem could also lead to a brain problem. With less sound information, it's harder for the brain to recognize sounds. It has to fill in the gaps, which require more listening effort. Having to guess what people are saying and what's happening increases the mental load on the brain and leaves less mental capacity for remembering and performing. Without enough stimulation in the hearing center, the visual center and other senses starts to compensate, which changes the function of the brain. Increased mental load, lack of stimulation, and reorganized brain functionality is linked to a delayed onset symptoms of cognitive decline, which could affect the ability to remember, learn, concentrate, and make decisions. And also, the brain problems could turn into life problems. The risk for dementia increases 5-fold for severe to profound hearing loss, 3-fold for moderate hearing loss, and 2-fold for mild hearing loss. Untreated hearing loss can affect balance, increasing the risk of fall-related injuries 3-fold. The best way to support the natural hearing system is to provide access to the full sound scene to people with hearing loss. Changing your perspective can change your life. For more information, please visit us at hearingpartners.com.sg.